This makes a difference when it comes down to what happens at a hospital, a medical facility, if any of us does actually get H1N1. In what way?
Absolutely, Fredricka. And it's important to remember that the effects of this national emergency being declared is going to affect more the administration at the hospital. So let me give you an example.
Okay.
About 3 or 4 weeks ago at our hospital in Memphis, the cases of H1N1 related illness, the influenza-like illness, had gone to 2 or 3 times the usual level. We could not sustain them in the emergency room.
And very early in the season, much earlier than anyone really anticipated.
Absolutely, and so it was quite concerning, and we had to set up a tent in one of the parking lots. Now, after we being declared as an emergency, even if we had to set up a site outside or away from the hospital, it would reduce a significant amount of administrative burden, which the hospital would not have to do when the emergency is declared.
And that's because you're talking about the distance. I guess prior to this declaration, you could have that tent or some sort of temporary facility set up so many feet away from the facility, but now with the declaration, you could bring it in a little bit closer, so it makes it easier for those who are administering care, right?
Well, what it does is it doesn't force the hospital to do many triage administrative things that they have to do. Because when we transfer patients from one hospital to the other, there are a number of protocols that we have to go through. And in the case of H1N1, and when we're seeing excessive number of cases, bypassing those protocols is really helpful.
Okay, well, let's look at some of those waivers. We've kind of built a screen here so people can kind of see what you're talking about. You talk about establishing alternate care sites. That was kind of the tent facility.
Right.
Modifying patient triage protocols. What are some of those protocols that you're talking about that can be modified?
For example, when we triage patients, when patients come in and they have a fever and cough, what we can do is take those patients and put them in a select area of the hospital. Previously, maybe thought that we're discriminating against a set of patients. And with these new guidelines, we're able to do that in a legal fashion, and we don't have to go through the administrative burdens.
Okay, and then making those modifications of transfers. We talk about transfers from one medical care facility to another.
Absolutely. In cases, we have rules such as EMTALA and other rules that require time, which in this case, we would be able to reduce a lot of that burden.
So does it concern you at all that now the administration has said we are making this declaration that this is now the second step in the two-step process for Health and Human Services Secretary Sebelius? Does it concern you, or you think this is the right time to do something like this early in the season?
I think it's the right time. I think it's appropriate. Clinically on the ground, I don't think it's going to affect our care for the patients. I think we're going to provide the same level of care that we are, and in fact, it'll reduce the work burden that many of the administrators and the doctors may have to go through.
Okay, Dr. Manoj Jain, thanks so much. And I understand, or at least I read, right, your daughter had H1N1, and I guess a lot of times people think people in the medical industry, they're probably immune to stuff like this, but when it hits home, it hits your daughter. You know, what was that like for you?
Sure. Well, I wrote an article in the Washington Post about my daughter getting a viral illness. I'm not sure if it was or wasn't an H1N1 illness, but, you know, there are lots of precautions that we can take at the house. I've talked about things such as social distancing, even, you know, keeping the children in the room and letting them watch TV and stay away from school for a couple of days is good if they're sick.
All right. Dr. Manoj Jain, thanks so much. Appreciate it, and glad your daughter's now feeling better.
Thank you.
All right. Take care.
Take care.